Bismillahirrahmanirrahim. Hello everyone. Welcome to MyPhysio academic mentorship. I am Dr. Amina Amjad and I am excited to guide you through the fundamentals of biomechanics in a simple and practical way. Let's start with the basics. Biomechanics is all about understanding how forces act on the human body. Basically, the mechanics of living systems. Mechanics is a branch of physics that analyzes the action of forces on mechanical systems. And in our case, the mechanical system is the human body. Mechanics has two main branches, statics and dynamics. Statics deals with systems that are in a constant state, either at rest or moving at a constant speed. For example, when a patient holds a posture during a physiotherapy exercise and their body is not accelerating, we are observing statics. Dynamics, on the other hand, deals with systems subject to acceleration, like walking, running, or any movement where speed changes. When we combine bio, meaning life, with mechanics, we get biomechanics, the mechanics of living systems. Biomechanics involves the principles of anatomy and physics in the description and analysis of movement. It is study of biological structures, processes, and functions by applying the methods and principles of mechanics. In physiotherapy, this helps us understand how forces act on joint and muscles and how movements are controlled and how exercises can be optimized to prevent injury. Here in this diagram, you can see. So why we study biomechanics? We study biomechanics to understand the forces that are acting on the human body and to manipulate these forces in treatment procedures so that human performance can be improved and prevented from further injury. Biomechanics is further divided into kinematics and kinetics. So kinematics is the study of the description of motion, including consideration of space and time. It is further divided into arthrokinematics and osteokinematics. Artho means joint, so arthrokinematics refers to the movement occurring between joint surfaces in relation to the direction of movement of the distal extremity of the bone. While osteokinematics concerns the movements of the bones themselves, as osteo means bones. So these are the movements of the bones. Kinetics, on the other hand, is the study of action of forces on the body, which includes muscle forces, gravity, and external loads. In simple words, biomechanics helps us bridge theory and practice. It explains why a movement happens, the way it does, and how we can use that knowledge to improve patient care, design effective exercises, and prevent injuries. Understanding these principles is essential for every physiotherapy student to analyze movement safely and effectively. By the end of this lecture, you will have a clear understanding of basic biomechanical terminologies, the principles of motion, and how they directly apply to clinical practice and everyday exercise. Remember, biomechanics is not just theory, it's a practical tool that makes you a better physiotherapist. Thank you.